A technician finds a sharps container that is overfilled and sharps are protruding from the opening. What should be done? A. Push the sharps down further into the container with a gloved hand. B. Stop using the container. Do not force additional items in and arrange for it to be replaced immediately. C. Tape the opening shut and continue using it. D. Empty the container into a regular trash bag. The correct answer is stop using the container. Do not force additional items in and arrange for it to be replaced immediately. An overfilled sharps container poses a significant injury risk. Staff should never manually compress or force contents down, and the container should be removed from service and replaced right away. A PCT notices a tracing with a QRS complex that appears unusually wide compared to prior tracings. What is the most appropriate action? A. Disregard it, since QRS width never changes clinical significance. B. Note the finding and report it to the supervising clinician for review. C. Erase the tracing and start over without documentation. D. Automatically diagnose a bundle branch block. The correct answer is note the finding and report it to the supervising clinician for review. A PCT should recognize and report unusual findings for clinical review rather than diagnosing the cause themselves, which is outside their scope. Disregarding or erasing the finding without report could delay needed care. Which statement about shoe covers used in isolation precautions is correct? A. They are part of standard precautions for every patient encounter. B. They are typically reserved for procedures with a high risk of fluid splash to the feet or floor, not routine isolation care. C. They eliminate the need for hand hygiene. D. They must be worn under sterile conditions only. The correct answer is they are typically reserved for procedures with a high risk of fluid splash to the feet or floor, not routine isolation care. Shoe covers are not part of routine standard precautions, but are used selectively in situations with significant risk of contamination to footwear, such as certain surgical or trauma procedures. What is the correct hand placement for adult chest compressions during CPR? A. On the upper third of the sternum. B. On the lower half of the sternum between the nipples. C. Over the left side of the chest directly on the heart. D. On the xiphoid process at the bottom of the sternum. The correct answer is on the lower half of the sternum between the nipples. Correct hand placement is on the lower half of the sternum to compress the heart effectively while avoiding the xiphoid process, which can fracture and cause injury. When cleaning around the PEG tube site, which finding would be considered a normal, expected observation rather than a complication? A. Foul-smelling purulent drainage. B. A small amount of clear to slightly yellow drainage with intact surrounding skin. C. Increasing redness spraying outward from the site. D. New skin breakdown under the external bumper. The correct answer is a small amount of clear to slightly yellow drainage with intact surrounding skin. A minimal amount of clear or slightly yellow drainage with healthy surrounding skin is a common expected finding, while purulent drainage, spreading redness, or skin breakdown suggest infection or complication requiring reporting. A patient asks a phlebotomist why their doctor ordered a fasting lipid panel. What is the most appropriate response? A. Provide a detailed clinical interpretation of what the results might mean. B. Explain that only the ordering provider can discuss the specific reason and clinical interpretation while explaining the collection process itself. C. Refuse to answer any questions about the test at all. D. Guess at possible reasons based on common knowledge. The correct answer is explain that only the ordering provider can discuss the specific reason and clinical interpretation while explaining the collection process itself. Phlebotomists can explain the collection procedure but should refer clinical interpretation questions to the ordering provider as it is outside their scope of practice to interpret results or diagnosis. What is the significance of the isoelectric baseline between waveforms on a normal EKG? A. That represents periods when there is no significant net electrical activity detected between events. D, that always represents an equipment malfunction. C, that indicates the patient is not breathing. D, that only appears during artifact. The correct answer is it represents periods when there is no significant net electrical activity detected between events. The isoelectric baseline reflects periods of minimal net electrical activity between depolarization and repolarization events and is a normal part of the tracing, not a malfunction or artifact. Why does OSHA prohibit recapping use needles by hand, the two-handed technique, in almost all circumstances? A. Recapping by hand significantly increases the risk of an accidental needle stick injury. B. Recapping is prohibited because it wastes time. C. Recapped needles cannot fit into sharps containers. D. There is no rule against recapping needles. The correct answer is recapping by hand significantly increases the risk of an accidental needle stick injury. Manually recapping needles using both hands is one of the leading causes of needle stick injuries, so OSHA prohibits this practice except when no feasible alternative exists and a one-handed scoop technique or device is used. Which symptom is most classically associated with a myocardial infarction heart attack? A. Chest pain or pressure, possibly radiating to the arm, jaw, or back. B. Sudden improvement in energy level. C. Localized rash on the abdomen. D. Painless swelling in the ankles only. The correct answer is chest pain or pressure, possibly radiating to the arm, jaw, or back. Chest pain or pressure that may radiate to the arm, jaw, neck, or back is a hallmark symptom of myocardial infarction, though presentation can vary, especially in women and older adults. When performing perinatal care on a female patient, the PCT should clean in which direction to reduce the risk of urinary tract infection? A. From back to front in a single stroke repeated with the same wipe. B. From front to back using a clean area of the wipe or new wipe each stroke. C. In a circular motion starting at the rectum. D. In any direction, as long as soap is used. The correct answer is from front to back, using a clean area of the wipe or a new wipe each stroke. Cleaning from front to back prevents introducing bacteria from the rectal area into the urethra, which lowers the risk of urinary tract infection. A technician overhears a coworker joking about a patient's appearance in the break room. Which ethical principle is being violated? A. Beneficence. B. Respect for patient dignity. C. Non-maleficence. D. Justice. The correct answer is respect for patient dignity. Mocking a patient, even outside their presence, violates the ethical obligation to treat all patients with dignity and respect. Which example best illustrates a non-critical item according to Spaulding classification that requires only low-level disinfection between patients? A. A biopsy forceps. B. A reusable pulse oximeter probe placed on intact skin of a fingertip. C. An endotracheal tube. D. A laparoscopic surgical instrument. The correct answer is a reusable pulse oximeter probe placed on intact skin of a fingertip. A pulse oximeter probe only contacts intact skin, classifying it as a non-critical item requiring low-level disinfection, unlike instruments that penetrate tissue or contact mucous membranes. Why is it important for a PCT to recognize early signs of cardiopulmonary compromise even though they are not responsible for treatment decisions? A. Early recognition allows timely escalation to qualified staff, which can significantly affect patient outcomes. B. It allows the PCT to independently begin advanced cardiac medications. C. It has no bearing on patient outcomes. D. It is solely for legal documentation purposes. The correct answer is early recognition allows timely escalation to qualified staff, which can significantly affect patient outcomes. Prompt recognition and notification can be life-saving even though the PCT does not make treatment decisions. since delays in escalation worsen outcomes in true emergencies. PCTs do not administer advanced cardiac medications. Which of the following best describes the underlying problem in congestive heart failure CHF? A. The heart is unable to pump blood effectively enough to meet the body's needs. B. The pancreas fails to produce sufficient insulin. C. The kidneys are unable to filter waste from the blood. D. The lungs are unable to expand due to airway obstruction. The correct answer is the heart is unable to pump blood effectively enough to meet the body's needs. CHF occurs when the heart's pumping ability is reduced, leading to fluid buildup in the lungs and other tissues. It is a cardiac disorder, not a pancreatic, renal, or purely pulmonary one. A PCT notices that a patient who is oriented to person, place, and time earlier in the shift is now unable to state where they are. What term best describes this change? And what should the PCT do? A. This is a change in orientation status and should be reported to the nurse promptly. B. This is a normal fluctuation that never needs to be reported. C. This indicates the patient is simply joking with staff. D. This indicates the patient needs new eyeglasses. The correct answer is this is a change in orientation status and should be reported to the nurse promptly. A new decline in orientation to person, place, or time is a significant neurological or mental status change that must be reported for further assessment. A patient with a splinted arm reports increasing numbness and tingling in the fingers an hour after splint application. This is most likely a sign of a normal healing progress. B. Nerve or circulatory compression from the splint. C. An unrelated skin allergy. D. A. Expected muscle fatigue. The correct answer is nerve or circulatory compression from the splint. New numbness and tingling after splinting suggests the splint may be compressing nerves or blood vessels and requires prompt reassessment and reporting. Before applying a splint to a suspected fractured forearm, the PCT should first A. Straighten the arm fully to align the bone. B. Check and document the presence of a distal pulse and sensation. C. Massage the area to reduce swelling. D. Apply ice directly to the skin for 30 minutes. The correct answer is check and document the presence of a distal pulse and sensation. Assessing circulation, movement, and sensation before splinting establishes a baseline to detect any worsening after the splint is applied. A technician is asked to help implement a new safety checklist required by an updated national patient safety goal. What is the technician's most appropriate role? A. Deciding independently whether the checklist applies to their unit. B. Following the checklist as trained and reporting any barriers to compliance to a supervisor. C. Modifying the checklist based on personal preference. D. Ignoring the checklist until it becomes mandatory next year. The correct answer is following the checklist as trained and reporting any barriers to compliance to a supervisor. Technicians are responsible for following approved safety protocols as trained and communicating any implementation barriers rather than independently deciding on or altering procedures. Which of the following best reflects a therapeutic communication technique appropriate for a patient care technician to use when a patient expresses anxiety about a procedure? A. Changing the subject quickly to avoid discomfort. B. Actively listening and acknowledging the patient's feelings while providing accurate, appropriate information within their scope. C. Telling the patient there is nothing to worry about. D. Dismissing the concern since it is not a clinical issue. The correct answer is actively listening and acknowledging the patient's feelings while providing accurate, appropriate information within their scope. Therapeutic communication involves active listening and validating patient emotions while staying within scope of practice by referring specific clinical questions to licensed staff when appropriate. Which waste item should be placed in a red biohazard bag rather than regular trash? A. An empty water bottle from a patient's tray. B. Gauze dressings saturated with blood. C. Used paper towels with no visible contamination. D. An empty medication box. The correct answer is gauze dressings saturated with blood. Items saturated or dripping with blood or other potentially infectious materials are classified as regulated medical waste and must go into a red biohazard bag, unlike items with no visible contamination. Which factor can reduce the effectiveness of alcohol-based hand rub? A. Applying enough product to cover all surfaces of the hands. B. Using it on hands that are visibly dirty or greasy. C. Rubbing hands together until dry. D. Using an appropriate volume as directed by the product label. The correct answer is using it on hands that are visibly dirty or greasy. Alcohol-based hand rub is less effective when hands are visibly soiled, greasy, or covered in organic material, which is why soap and water washing is recommended in those circumstances instead. As part of an exposure control plan, employers must offer which service to employees at no cost following a qualifying exposure incident: A. A confidential medical evaluation and follow-up. B. A mandatory salary reduction. C. A one-time cash bonus. D. Immediate reassignment to a non-clinical role. The correct answer is a confidential medical evaluation and follow-up. OSHA requires employers to provide a confidential medical evaluation and any necessary follow-up, including counseling and testing, at no cost to the employee after a qualifying exposure incident. Which of the following items would generally not be classified as regulated biohazardous waste requiring a red bag? A. Sharps and needles, which instead go in a rigid sharps container. B. Lightly soiled tissues with a small amount of dried mucus. C. Blood-saturated surgical gauze. D. Cultures and stocks of infectious agents from a lab. The correct answer is lightly soiled tissues with a small amount of dried mucus. Lightly soiled items with minimal dried contamination are typically treated as regular waste, whereas saturated blood products, lab cultures, and sharps meet the threshold for regulated medical waste requiring special containment. A patient care technician disagrees with an instruction given by the charge nurse regarding a task that seems outside their training. What is the appropriate first step? A. Refuse to do the task and walk away without explanation. B. Voice the concern respectfully to the charge nurse and clarify the scope of the task before proceeding. C. Perform the task anyway without raising the concern. D. Complain to a different department about the charge nurse. The correct answer is voice the concern respectfully to the charge nurse and clarify the scope of the task before proceeding. Following the chain of command means raising concerns directly and respectfully with the immediate supervisor first, rather than bypassing them or complying without clarifying a scope or practice concern. A national patient safety goal addresses the safe use of clinical alarm systems. Why is this goal important for patient care technician? A. Alarms are decorative and do not affect patient safety. B. Alarm fatigue from ignored or unmanaged alarms can delay recognition of a patient emergency. C. Alarms are only relevant to biomedical and engineering staff. D. Alarms should always be silenced to reduce patient stress. The correct answer is alarm fatigue from ignored or unmanaged alarms can delay recognition of a patient emergency. Excessive or unmanaged alarms can cause staff to become desensitized, potentially delaying response to a true emergency, which is why proper alarm management is a patient safety goal. A technician is splashed with a patient's blood on unbroken, intact skin of the forearm, while gloves were not worn. According to OSHA exposure definitions, how should this event be handled? A. It should be washed and reported per facility protocol, as any blood contact should be evaluated and addressed. B. It should never be reported since intact skin blocks all pathogens completely. C. It only needs to be documented if the skin later develops a rash. D. No action is needed since gloves were not required for that task. The correct answer is it should be washed and reported per facility protocol, as any blood contact should be evaluated and addressed. Even though intact skin is a strong barrier, and this exposure carries a lower risk than a mucous membrane or percutaneous exposure. Facility protocols generally require washing and reporting any blood contact for proper documentation and evaluation. A PCT notices a patient's urine appears cloudy with a strong odor. This finding should be considered a normal variation and not documented. Be reported to the nurse, as it may indicate a urinary tract infection. C. Treated by encouraging the patient to drink cranberry juice only. D. Ignored unless the patient reports pain. The correct answer is reported to the nurse, as it may indicate a urinary tract infection. Cloudy. Foul-smelling urine can be a sign of urinary tract infection and should be reported to the nurse for further evaluation. What is the recommended skin antisepsis agent commonly used for adult blood culture collection site preparation, given its efficacy and quick action? A. 70 isopropyl alcohol alone. B. chlorhexidine gluconate for patients over 2 months old. C. plain soap and water only. D. hydrogen peroxide. The correct answer is chlorhexidine gluconate for patients over 2 months old. Chlorhexidine gluconate is the preferred antiseptic for blood culture site preparation in patients older than 2 months due to its rapid, effective, and lasting antimicrobial action. Iodine-based preps or alternatives for younger infants or if contraindicated. A technician's personal social media account includes a post describing a crazy shift with details that could identify a specific patient's condition without naming the patient. This is A. acceptable since the patient's name was not used. B. a potential HIPAA violation since details can make a patient identifiable even without using their name. C. only a concern if the post becomes public. D. permitted as long as the post is deleted within 24 hours. The correct answer is a potential HIPAA violation, since details can make a patient identifiable even without using their name. PHI protections extend to any information that could reasonably identify a patient, even indirectly, so descriptive details without a name can still constitute a violation. During specimen collection, a patient begins having a generalized seizure. What is the most appropriate immediate response? A. Restrain the patient's limbs to stop the movements. B. Remove the needle and any equipment from the area, protect the patient from injury, and call for emergency assistance. C. Insert a bite block into the patient's mouth. D. Leave the room immediately to avoid liability. The correct answer is remove the needle and any equipment from the area, protect the patient from injury, and call for emergency assistance. During a seizure, the priority is removing sharps and hazards, protecting the patient from injuries such as padding or clearing the area, and calling for emergency help. Restraining the patient or placing objects in the mouth can cause harm. How many did you get right? Let us know in the comments and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.